It's interesting, when I was at university, which was a long, long time ago. University has only just been invented then, and every time I went to a party, it was always a smoke-filled room, and it was a strange-smelling cigarette that those people were smoking. Obviously, I didn't partake in any of that, but those days, the idea that people were depressed or had anxiety at university, there was nothing further from everyone's mind. They were so chilled out. Some people even found time to attend lectures and get a degree at the end of all of it. But we've got Sam Geimer, who's the Conservative politician who's the MP for East Surrey. He's also the Minister of State for Universities and Science. He's been saying basically that mental health in universities is a bigger concern for students than tuition fees. I think in the olden days, everyone was thinking a big problem for students was drug abuse. I don't think it's happening so much now, so we can't sort of blame mental health on drugs. But we have here the minister saying no, the health is a bigger problem than tuition fees. Well, on those two things, I wonder whether in fact they're linked. Whether that mental health is related to the fact that at the same time as studying, all these students are racking up massive debt. Let's find out what Rachel Piper thinks about that. She's policy manager at Student Minds, which is all about mental health for university students. It is a growing crisis, isn't it, Rachel? But I wonder how much of this crisis is being brought about because of this pressure to perform, because you're paying so much money for it. You want to get something out at the end of the day.
Hi, thanks for having me on the show today. I would say that what we're seeing more than the pressure of tuition fees is the pressure to succeed in a certain way whilst you're at university. So when you first go to uni, there's so many different things that you're trying to succeed at, your academic experience, social experience, and all that kind of thing. And if you're not really ready for that transition and that change from school to university, it can be quite a pressurizing time. But in terms of financial issues, I think a lot of people have struggle with the day-to-day cost of living, and we're seeing kind of rent a crisis in some places, the cost of food, and all of that kind of can be quite difficult on a student budget.
But is it getting worse? And if so, what's changed? Because as I say, I was at university decades ago. And the idea that anybody was suffering I wasn't certainly aware of anyone suffering mental health issues. Maybe it was around and it's just been brought to the surface more now and we can talk about it more. Or is it something that has developed? Is it a sign of our times?
Yeah, so I think you're right that more people are talking about it. We've seen a reduction in the amount of stigma, so people are feeling slightly less judged to talk about their mental health. And what we're also seeing is more people seeking support for a kind of range of different things. So whilst traditionally you might see mental health as something that only a few people have and it's a problem, like for a very extreme case, actually we all have mental health and we can all do with support, whether we're just kind of getting quite stressed out or we're developing mental health difficulties like depression, anxiety and eating disorder, that kind of thing. We are seeing an increase in demand at university support services, so at some universities 3 times the amount of demand in the last 10 years. At others less so. So, yeah, more people are coming forward to talk about their mental health, and we are seeing an increase in the severity as well.
And I guess there's more competition these days, isn't there? I mean, there was competition to get into university when I went to university because relatively few people did. Whereas these days, what is it? 1 in 2, I think now, 18 to 30-year-olds are going to university or have been to university. So, completely different kettle of fish. And I guess that puts more pressure on it. So, in my day, it was like you got through to university. You get out of university, you almost certainly were going to be okay for a job. These days, you're going to university, but so's everybody else. And so you've still got that pressure about how you're going to come out at the other end.
Yeah, I think that's true. A lot of students do perceive there to be and do have a lot of pressure on them whilst they're at university. I think that a lot of students are also working whilst at university in order to pay their way. So that can be quite a lot of pressure. But mental health can come from a huge range of factors. So that might be one risk factor, but there's lots of different things that could affect someone's mental health. Yeah.
What about dropping out? I mean, I guess it's hard to drop out as well because you spent money on it. You drop out, you still owe money, you've got nothing to pay for at the end of the day. Whereas perhaps, if you didn't have that pressure, you'd go, well, this is just too hard. I made a mistake. Let's move on.
Yeah, it's a really difficult thing to make that decision about what's right for you, and what we really want to see is more people being informed properly about their choices before they go to university, so that they are able to kind of be in the right place for them, and then when they do switch over or do make a change, they're well supported to do that in a way that doesn't kind of leave them falling through the gaps a little bit.
So Is it because, I mean, it is a big transition, obviously. You've left home, you've left mum and dad, you've left the comfort of home. For most people, I mean, some people do still stay at home while they're going off to university, but that's not the norm, obviously, is it? That you do get away, it's you're breaking out, it's your first touch of real freedom, I guess, for a lot of people. And it's a lot to adapt to.
Yeah, you're completely right. It's a huge amount to adapt to. Kind of any of us imagining, say, moving house, getting a new job, losing all your friends, moving out from your family, and all of that at once. For anyone, that would be quite a significant amount of change at once. But a few weeks ago, Student Minds launched a resource called Know Before You Go, and another one called Transitions, and they're both available on our website. So if you are someone who is in that position of you're going to uni and you're just like, oh, I'm not sure about all these different things that are going on, or if you're a parent, then that might be something useful for you. And you don't have to have a mental health problem. They're just simple, all the things that you might experience whilst going to university that are covered in that guide.
Yeah, because the term mental health is an interesting one. It's because it can be, a whole load of things could get branded under mental health, and some of it you might just go, well, everybody goes through a bit of that uncertainty when you move into a new area of your life, and maybe it's some of that which would just be treated as part of the normal process of things.
Exactly. But what we see is that it's actually perfectly normal to undergo a certain amount of stress and have ups and downs in your normal day-to-day experience. And where that becomes an issue that you might need support is when it's affecting you on a day-to-day basis and you're not feeling that you're kind of overcoming those challenges and you're feeling like quite a lot of difficulty from those experiences. So, for example, if you're behaving differently and you're feeling differently every day, and that doesn't alleviate, that might be a position where you want to get support.
Yeah, and who do you turn to? I mean, is it the job of academic staff? We used to have a tutor, which you go and see in the morning. My tutor didn't really care he just wanted to make sure that I was doing all my coursework and I was turning up for lectures.
Yeah, so there's lots of different places where you can turn for support. So at universities, most have a student support service, so it might be called a wellbeing service, it might be a counselling service. And at those, you can get a range of support from counsellors, mental health advisors, from cognitive behavioural therapy. There's different things that suit different people. You can also go to your GP, who will be able to refer you on to what's appropriate for treatment. Or, a lot of people just turn to their friends and family in the first instance and find that quite a simple conversation to help overcome something stressful might just prevent them from it developing into a problem. We all know that if we bottle something up for a long time, it can really build. So, we recommend just reaching out to whoever you feel comfortable with in the first instance. And then if they aren't supportive, just remember that there are other people out there for you. And, if they are a bit like, oh, what you're talking about in the first instance, then there are other people that you can reach out to.
All right. Well, Rachel, great to talk. Thanks for coming on.
Thank you.
And Rachel Piper, a policy manager at Student Minds. Part of me thinks, and I'm sure there's some people listening going, just these young snowflakes. I managed to get through university. It wasn't a problem at all. Everyone's talking about mental health these days, and everything is a disease. We're riddled with it. Maybe we just need to battle on through because that's what we always did, which I think, there's an element of that. But if people are talking about these things, if people feel happier to talk to other people about the way they feel, and that's got to be a good thing ultimately, hasn't it? It's Love Sport. Phil Dobbie filling in for Kelvin McKenzie for the next 25 minutes or so. Stay with us.